are going to talk about recurrent pregnancy loss. There's been about a bit of debates about its actual definition, but we've agreed that recurrent pregnancy loss is a pregnancy loss of two to more than two pregnancies that have before 24 weeks. It affects the physical, the social well-being of every woman. It's a very traumatic experience for a family, and it is quite common. Though the statistics are not very clear, because this is something most women don't talk about, especially in our culture. They don't count those losses. So sometimes you have to dig deep to find out what it is. But about generally 10 to 15% of pregnancies will come out, or they will be aborted in the first trimester before they make 3 months. But about 5% of women will suffer recurrent pregnancy loss. And unfortunately, still many come late. So it comes as part of history, or when they think they've taken too long to have a child, then they'll come to the clinic and then it will come as part of history. It normally doesn't come as a problem. So they'll tell you, maybe I've lost 3 or 4 pregnancies. So there are people who lose the pregnancies the first 3 months. But in here, what we call recurrent pregnancy loss is usually a pregnancy that has been confirmed to be well, and then eventually it comes out before it makes about 6 months. So they're usually about 3 to 6 months that you have evidence of a pregnancy that is normally growing, and then eventually it fails before 6 months. We can't say we actually know the cause, but what we talk about are risk factors that a woman who is like this is likely to have. But sometimes you cannot find, in 70% of the cases, you really cannot pinpoint a cause for that pregnancy loss. But we have found maternal age, very young women and women who are above 35 years are likely to have this condition. Some women have endocrine factors, like the hormones in their body are not working well. Some conditions like diabetes, thyroid disease. There are women who have what we call autoimmune diseases, where the body kind of destroys itself or parts of itself. They tend to have that. Then some women have blood disorders that prevent a pregnancy from going on, because for a pregnancy to grow, there are changes in the blood system that enable this pregnancy to continue growing. Then some women have uterine abnormalities, women who have abnormal uterus that maybe has a separation, what we call a septate uterus. Women who have fibroids are also likely to have a pregnancy loss. And then vitamin D deficiency has also been mentioned. Right now we have many people who stay indoors the whole day, who never taste the sun. They think it may be a cause. The research is not very conclusive. Then, of course, infections. Here in Africa, infections really ranks high. People who have had syphilis, for example, gonorrhea, chlamydia, those sexually transmitted infections may actually have that. That's why we do screening for some of these infections on the first day of booking in for pregnancy. And then stress, pollutants. Of course, we don't have many smokers here. Alcohol may contribute a bit. Those are some of the risk factors may cause a recurring pregnancy loss. As I said, there are still women where you will not find a cause, even when they've lost so many, like 10.